Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about that numb patch, that numbness feeling that you feel in the certain part of your knee after knee replacement surgery. Hi everyone, so today we're going to have a short video here. We're going to talk about a little bit about a very common thing to experience, very normal thing to experience with your knee replacement surgery, and that is a small inch, a little more than an inch, maybe 2 inches, numb patch, numb kind of circular oval patch of numbness that you feel after knee replacement surgery. And this is usually felt along the outside part of the knee and kind of that lower outside part of that knee. So kind of the lateral lower part of your knee joint. And what is going on is when you have knee replacement surgery, they obviously have to make the incision down the middle part of your leg, middle part of your knee, to get to the knee joint to perform the surgery. And what happens is when that incision is made, it actually is going to disrupt one of the nerves that travels in your leg. So it's going to disrupt a nerve. So you have your saphenous nerve, which is a very big, very long nerve with a lot of branches, and it's a sensory nerve. And what that means is it provides information about sensation. So feeling, touch, information coming into the system. It's not a motor nerve, so there's no problems with being able to contract your muscles or perform movements, but it's a sensory nerve, so that's where you get that sensation of numbness. And with the incision, with knee replacement surgery, what it affects is the infrapatellar branch. So the infrapatellar, meaning under the patella or under the kneecap, and it's just basically a branch of that saphenous nerve that gets nicked, gets disrupted with the incision with knee replacement surgery. And so what happens is, again, you get this small patch, an inch or two maybe in diameter, but it's just this patch of numbness, patch of absence of sensation. And typically what happens is over time, as your body heals, as the nerve heals, as everything starts to heal, this numb patch is going to improve. So it's going to get maybe a little bit smaller. You start to experience feeling, not notice it as much, and it's just going to improve slowly over time. Now, some things to keep in mind is sometimes you will have a little bit of that residual numbness there. For not everyone is going to have that numb patch completely disappear. Some people might still experience a little bit, but it's relatively harmless, something most people tend to notice less and less over time. Basically just an area where you don't have as much sensation. Now, some things to keep in mind, there are other causes of nerve-like symptoms and nerve-like pain, so that pins and needles sensation, numbness, tingling, sometimes burning, painfulness. That can be caused by some other things as well. And if it's different in nature, it might be worth getting it further checked out, having further consultation with your doctor, with your physical therapist. So for example, there's sciatica type pain and numbness and symptoms. Usually this is going to be like a radiating pain, so it might start up in your low back or in your hip and kind of wrap around the leg, wrap around the knee. It might come down further, travel down towards your foot and ankle. This is kind of that radiating pain. You're going to feel more so along kind of a portion of your whole leg almost, or at least up near your hip more, and then it travels down to the knee. It can kind of be in patches, but usually that's more of that radiating type of pain. Then you also have things like peripheral neuropathy. So peripheral neuropathy typically is experienced as this numbness, this lack of sensation, pins and needles, sometimes painful, sometimes uncomfortable, and that's going to affect your legs, your feet, your lower legs. And this is basically the nerves of your lower legs are not as healthy, they're dying. Typically it's felt on both legs, both sides, and that's peripheral neuropathy. And then one other thing to keep in mind is sensations of a nerve block. So this is something that's done during surgery to help provide pain relief. So for example, a very common one is your femoral nerve block. So there's a block of the sensation from that nerve that travels and provides sensation to your knee joint. And by blocking that nerve, that helps provide some pain relief. And as that wears off, you might experience some different symptoms from that in the first few day or two after surgery. So overall, the numb patch, relatively harmless. If you start experience things that seem a little bit different, seem a little bit not the same little numb patch on the little outside part of your knee, it may be something else going on and may be worth consulting with your physical therapist, with your doctor, just to make sure you are managing everything effectively, and if you need further testing or further evaluation, that can be provided. This has been the Need to Know Show. This video is about the little numb patch that you feel on your knee after knee replacement surgery. As always, please feel free to subscribe. Click the button in the lower corner. We post videos every day, everything related to knee replacement, preparation, recovery, the surgery itself, and commonly asked questions. Thank you very much for watching, everyone. Have a great day.